Well, thank you. Well, I thought about what I wanted to present today. I really wanted to, I really sort of thought about the what Dr. Marie Hanna talked about as the theme of this conference and innovation. And I wanted to share kind of what's innovative and new in the space of integrative medicine and integrative health. So in the integrative health space, one of our big goals is we really are trying to cultivate vitality and wellness and resilience and health. So we spend a lot of time sort of thinking about, well, what creates that? Where does it come from? Who's the fairy doling out, the health virtues in life? Are we doing it with our prescription? And I always, find this slide very humbling because as physicians, we get into this field because we do want to help people and we do want to improve their lives and give them value. And, when I look at this, we have very important interactions with patients. But far more than that, our brief interactions and infrequent interactions is these big swaths of the behavioral and lifestyle. Those far more impact someone's health, wellness, resilience, baseline health than any one interaction with the physician. So when we think about, in the integrative medicine space, some of our founding principles, not only partnering with patients, but what I really think about is all we're doing is that we're expanding our toolkit. So we're using all of the, best care standards that we have in our Western practice. And then in our 2-year integrative medicine fellowship, we're really studying the evidence behind and utility of sort of all the other approaches to health, wellness, resilience that are globally used, and then applying that to our patients in addition to our best care standard practices. And what I particularly appreciate is, I've been in medicine long enough that I really remember 20 years ago when there was, just the race for understanding genetics. If we can sequence the human genome and understand the genetic underpinnings of lots of diseases, then we are going to really, using SNPs and CRISPRs, and we're going to really just revolutionize health. And it was really exciting. And we did a lot of that, right? We sequenced the human genome and we really have a much better understanding of genetic underpinnings, but we kind of went, yep. But that's still not the whole picture, right? So this last decade or so has really been understanding, well, what for any one person turns on and off these disease gene predispositions, for lack of a better word, that we have. So all of these epigenetic influencers, that I kind of in my head, trying to be relevant, call them social, all the social media influencers. So all these epigenetic influencers that are turning on and off these disease genes. And one theme that has consistently come up is that is underneath not only chronic pain, but it's underneath the spread and growth of cancer. It's underneath cardiovascular disease. It's underneath autoimmune issues. It's this chronic low-grade inflammation. It just creates that background chemical milieu that seems to create these signaling pathways that leads to worse health outcomes. And integrative medicine is really perfectly situated because a lot of the interventions and approaches that we have really do get at that mechanism of chronic inflammation. I mean, we know nutrition is one of the most foundational applications to creating health and wellness, and sort of the anti-inflammatory diet. It says it right there. It's not rocket science, but we know that nutrition, when you add sort of whole food diet, makes a big difference. And I always chuckle to myself because I work with a lot of sort of patients in the cancer space, and they're a wonderful population because they're incredibly motivated to do everything they can to stack the odds in their favor. And so when someone comes to me and they've kind of went from, a standard American diet and they've kind of switched over to whole foods, kind of an anti-inflammatory type eating pattern, and they come and all the things that we struggle so much with, all of the aches and pains and the back and the arthritis, they kind of go, oh yeah, all that's gone. My sleep is better. My pain is gone. So I love that. And that's just their aside, that's just kind of like, oh yeah, by the way, all that arthritis we were dealing with, that's gone. So, some of the interventions that we do, the acupunctures, the, yoga therapies, massage, I love that now we have so much better understanding. For example, acupuncture. When we are looking at, targeting, what is acupuncture? The tip of the needle, we're targeting the fascial tissue. We now know that's richly innervated with the autonomic nervous system and all the neurotransmitter signaling that changes when we use needles in that way. And that gets at that. And stress reduction, I think it's really dealing with that autonomic nervous system balance. And, being in anesthesia and integrative medicine, I think it's There's so much value in understanding and modulating that autonomic nervous system. Because again, when we are balancing that stress response and the parasympathetic sympathetic balance, and we're living lives that are skewed toward sympathetic upregulation, that's inflammatory. And again, that creates more of those chemical signaling that is leading to inflammation. So what is coming down the pipeline in intervention is health coaching. And so the roots of professional coaching in healthcare are really rooted in evidence-based psychological domains and theories on how to generate effective behavior change. So this is the translation. All the beautiful knowledge in the world and educating of the patients really doesn't amount to a hill of beans if they're not translating it and using it in their life to its best effect. So what do? I just want to give you a little background because this is a huge burgeoning industry and field, and they're going to be out there and they're going to want to interact with you because they're not physicians, they're not providers of pain care, but they're that little missing link of translators. And so when they come into your world and knocking on your door and want to interact with you, I want you to have a better understanding of who they are, what their skill set can do, and how they could be of value to you. So, physicians are trained in an expert approach. It's how we're taught, right? We spend all this energy and time learning material and being experts in this field. And we're trained to answer all these questions. And if we're not, we're going to go Googling to find the answers when patients come asking questions, aren't we? And, our goal is to determine the diagnosis, give a treatment, and patients expect this approach when they come in for a sick visit. The issue is when we apply that same expert approach to implementing behavior changes, we know from best science that that's not what achieves sort of the best outcomes. These external sources of motivation, a physician going, this is going to be really good for you and it's going to help lower your pain. If you reduce your stress, you exercise, you can sleep better. It just doesn't generate that internal motivation that most correlates with lasting engagement in behavior changes. So we're, using that approach, we're really coming up against everyone's inner 3-year-old child because, we're sort of wired to be autonomous and we resist when people are telling us to change. It's not that we don't want to change. It's just that we don't want people telling us that we need to change, even when those people have our best interests at heart, and they do, right? So I always imagine I'm talking to that inner 3-year-old, and that's why this approach is a little bit different. So the the skill set of healthcare coaches is a little bit different, and it takes a little bit different skill set that we're just not trained in. We're not trained in motivational interviewing skills and some of these psychological approaches that generate more lasting behavior change. And I think this illustrates sort of a little bit of the differences in approach. When we have what we consider our expert approach, when we're, coming to patients, we give them our expertise. That's what they're there for, right? They want our expertise, and we give them answers, we educate, we find the problem, we treat it, we advise them, and we educate them. And why do we do it that way? Well, we're trained that way, that's fine, but it's efficient. It's time efficient, right? As an anesthesiologist, I call what we do medicine for the impatient, because I don't have a big wealth of empathy and time that I'm going to sit there and do that over and over all day long. So I want to get things done and be efficient. But this approach to create sort of these down the road, long lasting behavior changes, that takes a little bit of a different approach because we're having to foster and cultivate some of these inner strengths and these personal attributes of the people we're working with. Again, all that wonderful advice you have is not going to do great things if they can't translate it and make it work in their own life. So in some ways, you might kind of get the idea that they're there to be their best friends and this is psychotherapy and their therapist. In some sense, yes, they want to get in their head. They want to understand how they think so that they can then help them move forward. But it's not there to, look at traumas and develop coping skills. It's a little bit different focus. I want to also make sure, point two there, that coaches are not necessarily, they don't always come from a healthcare background. So they are not the dietitian. They are not someone with expertise in chronic pain and dealing with it. So they are not making diagnosis and coming up with treatment plans. Again, they're that translational piece from coming up with a plan that a provider and a healthcare expert may do and helping them implement that, something that works in their life for that individual person. That's the personalization piece of this implementation that they can do because of their training. So while we have a variety of, beneficial outcomes that have been shown in studies for, diverse healthcare conditions like managing diabetes and hyperlipidemia and cancer pain and losing weight and engaging in physical activity, we still have a dearth of strong research outcomes. And however, despite that imperfect evidence that is, beginning to be built, social support, we know that having an accountability factor does make people more likely to engage in lasting behavior change. Paying for it. Okay, this is again one of those important translational pieces. So when these people, if a healthcare coach comes to you, you're thinking about that they might be valuable for your patients. Some insurance companies are now starting to see the value of this for long term. So they are engaging healthcare coaches and hiring them on their teams and then offering incentives to their members so that they're reducing kind of their long-term costs. These are some examples of insurance companies that are offering coaching programs. Often they add perks onto that to utilize those resources. Aside from that, some private pay health coaches are doing group medical sessions. Dr. Irina Todorov did a session talking about group medical visits. One of my colleagues right there in the back there, who in the last session talked about the value of the group medical visit. Private pay then is your last resort. People are, having their own business and it becomes this out-of-pocket cost. People can use flexible spending accounts. If you're creative and entrepreneurial, you might be thinking about, well, where are training programs that they are training people to be healthcare coaches? Because usually they need training hours, right? And maybe that's something that you can then utilize and engage with a training program to maybe have access to your patients. So what does training look like? Until 2015, this was really kind of the Wild West, and there was no standardized training standards and educational models for this. But that changed in 2015 by the National Board for Health and Wellness Coaching. If you take away one thing from this conference, or not from today's talk in this conference, it's that website, that organization website. I think, when I think about what can I take home and put into practice Monday morning, you may want to browse that website and say, who's near me? Who, if I had a patient that I think could utilize something like this, where might I find them in my neck of the woods? So they collaborated with the National Board of Medical Examiners to create an exam. So aside from standardized training, a 4.5-hour board exam, 200 hours of training before they can become certified, that is what the training standards are for health coaches. I just wanted to give you a smattering that now we're starting to apply this approach and what does it look like for patients having chronic pain? And we're starting to see early and good outcomes. Again, when we engage in using this approach for people experiencing chronic pain. One paper that I think, even though it's a little older, it gives a great background if you want one paper to kind of give yourself a grounding in the idea of healthcare coaching and the skill sets. The thing I love about this, and this is my last slide, is that this is one thing I think that can take something actually off of your plate, right? Everything you learn at a conference is like, okay, now I'm going to add another diagnostic study and I've learned a new skill and I want to try this new approach. This is something that can actually make your patients better patients for you to treat and take it off your plate. All right, thank you.